So the HIV medical home that we're creating is a model where we provide as many integrated services as we can on behalf of people living with HIV.
So it's a place where patients with HIV can come and get care, and when they come into the facility they can get medical care, they can go to the pharmacy, they can see their social worker / case manager to help them with all their other issues so far as housing, nutrition, insurance. They will be able to go to a food pantry, they will be able to access mental health, and eventually they'll be able to access dental care here.
I feel like I have an ally now when I once was alone. To be honest with you, HIV care hasn't really taken a forefront as being important in the world, and I can see that now it's finally starting to become just part of healthcare instead of a separate issue.
You know, I've been working in HIV a long time, and I've been blessed to know a lot of people with HIV and their stories. And many of them are facing stigma and don't talk a lot about their HIV status with what would otherwise be natural sources of support. And so being able to create an environment that is designed for them and is full of people that are welcoming and committed to making their lives better. And then we get to work side by side with each other. All of this is right here.
And one of the beauties of this clinic is once we get them into care for their HIV or for their PrEP, we can address all their other health concerns as well. We can act as their primary care physician to treat their blood pressure, their COPD, their heart disease, their diabetes.
We're really not trying to reinvent the wheel. So if folks are doing service delivery and doing it well, what we want to do is partner with them so that we can offer that integrated model on site. HIV is a significant problem in St. Louis. There are about 6,200 people living with HIV in this region. So what we're really looking to do is attack HIV in two ways: prevention and treatment.
There's a medicine that someone who is HIV negative can take to help prevent them from getting HIV, but the key is to get people who have HIV, number one, to know that they have it, to get tested and diagnosed. Number two, to get on medication, because we know that if someone who has HIV is on medicine and has an undetectable viral load, so they're on medicine and the virus is completely suppressed, they will not be able to spread infection to another person.
What we find in St. Louis, and this happens in most urban settings around the United States, is that there's a convergence between HIV and poverty. And so case managers are working to do a complete assessment with each client to identify what their barriers and needs are, and then create an individualized plan around the support that they need. Ability to pay is not a factor in any service delivery that we do here.
The biggest barriers to getting patients into clinic and keeping them in clinic is access to care and transportation. So this is a chance for them to get them here. Once they're here, they can access all the things that they might need for their overall health.
People who are diagnosed with HIV now, if we get them into care early and keep them at an undetectable viral load level, they can easily live into their 70s and 80s. This is not what it used to be. And so this work is important to me because I want to make sure that everyone gets the access to care that they need. And when I think about what we could achieve over the next 15 or 20 years, I'm really excited about changing the landscape of HIV infection in this country.
People should not have to hide that they have HIV. But they do, and it's 2019, and I think that's about time for that to stop.